Hello, I'm Katie Morales from the University of West Georgia in Carrollton, Georgia. The co-author of this presentation is Dr. Sandra Monk from Rome, Georgia. The presentation is entitled Healthcare Workers' Health Beliefs Regarding Personal Protective Equipment and Their Calculated Risk for Infection During the COVID-19 Pandemic, which summarizes the objective of the study.
The method we used was a mixed method design, and the quantitative phase was a non-experimental descriptive design via an online survey posted on social media. And then our qualitative phase was basic qualitative design using semi-structured interviews. The theoretical framework for our study was from the health belief model. In the quantitative phase of our sample, we had 207 completed responses. And for the qualitative phase, we reached saturation after 5 interviews. Our instruments were all researcher developed from the literature, and they were revised after review by 6 experts.
Our findings were, for susceptibility and risk, there was a significantly moderately positive correlation between perceived susceptibility and calculated risk for direct and indirect care providers, indicating as perceived susceptibility goes up, so does calculated risk. This indicates healthcare workers can accurately assess the risk as supported by the qualitative findings. For the health beliefs, the total scores, those vaccinated, nurses, and/or those living alone were more likely to score higher, with nurses significantly higher than all other roles. Vaccination status, all subscales except susceptibility and total, found to be significantly different between vaccinated and not vaccinated. For perceived seriousness, those vaccinated and/or at unionized facilities were more likely to score higher. For perceived benefits, those living alone were more likely to score higher, which may indicate a sense of vulnerability. Participants in the qualitative phase believed PPE use was effective, although this waned as the pandemic endured. However, there is no consensus on the benefit of vaccination and no mention of hand hygiene. Perceived barriers, nurses scored significantly higher from all other roles. Participants in the qualitative phase expressed a lowering of standards related to PPE use due to limited supplies. Cues to action, those with adequate PPE resources, vaccinated and/or living alone were more likely to score higher. For self-efficacy, participants in the qualitative phase expressed a need to advocate for themselves due to a lack of clear guidelines or standards. Participants perceived they had better understanding of the processes related to PPE use than management. While they had praise for middle management, they felt abandoned by upper management.
Limitations of our study was a lack of diversity in the sample, and we also use a convenient sample, which may introduce bias and limit generalizability. Recommendations include providing clear and up-to-date guidelines regarding PPE use via multiple platforms, calculate the risk for adherence to PPE, eliminate barriers by polling staff, and cues to action, which would be verbal and visual cues to improve PPE adherence.
There's a list to our references in the QR code, and our contact information is included. Thank you.